Carey Bamber asked me to do a webinar on Wellbeing Teams and mental health. Carey is the Policy Advisor with the Association of Mental Health Providers, and this is a summary of how we think Wellbeing Teams can support mental health. It was developed with my colleagues Jane Peitling and Rob Michael Phillips, who between them have experience working as a social worker, an NHS manager, and as a chief exec of a local mind. So the first one is co-production. Research shows that services that are co-produced are the safest and deliver the best outcomes for people. Wellbeing teams are built around effective co-production, supporting people's aspirations through delivering person-centred, outcome-based care. We address what matters to the person, giving them control of their support, and we accept that there's times and circumstances where power and responsibility are not and cannot be shared equally, but wellbeing teams can work to satisfy statutory obligations and at the same time add real value to the life of the person being supported. An asset-based approach. Wellbeing teams take an asset-based approach, supporting the person to build on their assets and to protect what's already working for them. Sometimes, even with the best of intentions, the way we organise our services creates barriers that prevent people, their families and communities from doing things for themselves. The wellbeing team approach ensures that people are supported to be as independent as possible and that support from family and friends is welcomed and proactively incorporated into the plan and through community circles. A wellbeing team might liaise with other professionals to streamline or reorganise visits to enable a person to continue to meet a friend for lunch, or they might arrange a weekly lift with a neighbour so the person can continue to their own shopping. A sense of purpose and being able to contribute and give is part of good mental health for all of us. Becoming a community circles facilitator is an opportunity for people to volunteer, boosting their own well-being, gaining experience towards employment, and as a positive example for people receiving support. This could be another way to provide peer support as well. Continuity of relationships and support. Wellbeing teams offer the opportunity to create consistent approaches and sustainable relationships as a person travels through mental health services. Often services are arranged to meet certain levels of need. For example, a person might experience care during an acute episode of illness from one area of service and then be transferred to another area of service and group and staff who provide rehabilitation support. Wellbeing teams can offer consistent support from a small team of staff, and creative commissioning could allow this team to flex levels of support but maintain a relationship with someone throughout their experience of services. This is achieved both through the wellbeing workers and through the community circle. Using technology. Wellbeing teams make proactive use of everyday technology as part of their approach to support. This can be supporting someone to use Facebook or WhatsApp to keep in touch with friends or family, helping someone to complete their online shopping order for delivery, or download an app that helps them relax. Promoting wellbeing for everyone. Wellbeing teams model wellbeing for everyone. Everyone working with and for wellbeing teams are supported to enhance their 5 ways to wellbeing, and they each have their own wellbeing plan. We think these 5 contributions are worth exploring further, and Jane and Rob are doing this, looking at different service models or new models of care that could have a positive impact on the mental health of people who use services and on the people who deliver them as well.